So as a continuation of the external air class, in this session we'll be dealing with the external acoustic meatus. You can see here. So we have earlier studied the auricle. Now the auricle from the concha, you can see the extension of the external acoustic meatus. So this is the external acoustic meatus. You can see it is approximately 24 millimeters long. It has an outer 1/3 of cartilaginous part and it has an inner 2/3 of the bony part. You can see the cartilage of auricle continues with the cartilaginous part of the external acoustic meatus. So external acoustic meatus extends from bottom of auricle up to tympanic membrane, 24 millimeters long, lateral 1/3 cartilaginous, approximately 8 millimeter, medial 2/3 osseous, 16 millimeter, S-shaped curve. It has 3 parts. The direction of each part is very important. Pars externa, direction upwards forwards medially, pars intermedia, upwards backwards medially, and pars interna, downwards forwards and medially. So if you want to visualize the tympanic membrane and see the entire external acoustic meatus, we have to pull the auricle upwards, backwards and laterally to make the meatus as straight as possible to visualize tympanic membrane. Cartilaginous part continues with the cartilage of auricle. Upper and posterior part of the meatus, that is especially the cartilaginous part, the cartilage is absent, replaced by fibrous membrane. In the anterior wall, 3 to 4 fissures of Santorini are seen. Bony part, below and in front, tympanic plate of the temporal bone forms the bony part, and above and behind formed by the squamous part of the temporal bone. Tympanic sulcus is seen at the medial end of the meatus, gives attachment to the tympanic membrane obliquely, so that floor and anterior wall are longer than the roof and posterior wall of the external acoustic meatus. Hiatus of Huschke, it's a small foramen in the anterior wall of the bony part. It is due to incomplete ossification of the tympanic plate. So note, deep insertion of speculum in children is to be avoided as external acoustic meatus is shorter, which can result in tympanic membrane damage. And if you see in the newborn, bony part of the external acoustic meatus is not developed and is represented by a tympanic ring of bone. So we have to be very careful. Never insert speculum into the external acoustic meatus of a children because it is short, it will damage the tympanic membrane. There are 2 constrictions in the external acoustic meatus. One is at the junction of bony and cartilaginous part. The other is at the isthmus, which is approximately 2 centimeters deep to the concave. So which is an narrower of the both constrictions. And there is an obtuse angle which projects anterior-inferiorly at the junction of bony and cartilaginous part. So this is the most difficult part when we are removing a foreign body from the external acoustic meatus. The skin of external acoustic meatus continues with the skin of auricle as well as cuticular layer of the tympanic membrane and adheres to the bone and cartilage. Inflammatory exudates which accumulate below the skin in this region are extremely painful because they create tension as the skin is adhered here. So modified sweat gland, ceruminous gland are present in cartilaginous part. They secrete cerumen, or is called earwax. It will maintain warm, humid environment, opposes entry of insects, prevents maceration of the skin. So if you see in front, external acoustic meatus is separated from the head of the mandible by parotid gland. Above the bony part, there is medial cranial fossa and epitympanic recess of the tympanic cavity. Posterior superior to the bony part, mastoid antrum separated by mastoid air cells and thin plate of bone. So if you want to approach mastoid antrum through this, we call it as transmeatal approach to mastoid antrum. Arteries, posterior auricular artery from external carotid artery, deep auricular artery from maxillary artery, and anterior auricular artery from superficial temporal artery supplies the external acoustic meatus. In veins, drains into external jugular vein, maxillary vein, and pterygoid venous plexus. Roof and anterior wall supplied with the auricular temporal nerve, floor and posterior wall by the auricular branch of the vagus called as nerve of Alderman. The only cutaneous branch of the vagus. So applied aspects, ceruminosis, excess accumulation of the earwax, blocks the meatus from good sound vibrations. Treatment, wax can be removed by syringing using lukewarm water. We have to use lukewarm water because extreme hot water or cold water will stimulate the auricular branch of vagus, which results in severe coughing, sometimes heart attack, because vagus is cardio inhibitory. Inflammation of skin in external acoustic meatus extremely painful due to skin adhering to the underlying bone and cartilage. So you can also see absence of external acoustic meatus along with the auricle in anonychia conditions. You can see here, this is a case of microtia on the right side. On the left side, you can see complete absence of the auricle and the external acoustic meatus. Anotia with absence of external acoustic meatus. Thank you.